Okay, it looks like most people have made it in the room, so I'll go ahead. My name is Erin Jensen. I am a program coordinator with the Transforming Communities Institute, and I'm over community education and professional development. If you ever have any questions about your CEUs, or if you attend an event and you don't see your certificate, I'm the person you can reach out to. My email is erin.jensen@usu.edu, so don't hesitate to reach out if you have any questions. Um, for your information, the session is being recorded and will be shared on YouTube in the next couple weeks following this session. A few kind of pieces of housekeeping as you're listening today. Please be sure that your Zoom name matches the name you're going to want on your continuing education certificate. That's how we track attendance and we see how long you're in the session. So it's really important that that name matches, or you won't be able to earn those credits. Also very important, to earn those credits, you must complete the follow-up survey that I'll post in the chat at the end of the session. It'll also be sent to you via email, so if you have to leave a couple minutes early, no big deal, you'll still get that. But you must complete that certificate, or excuse me, that survey in order to get your certificate. And the number of hours you receive is based on the time that you spend in this Zoom session. If you have any questions during the session, you can go and ask them in the chat, and I will read those to Maureen as it goes. She's fine with questions kind of as they come up. She's open to that. And at this time, I think that's all I have. I'll go ahead and turn it over to our presenter, Maureen Boyle.
Thanks so much, Erin. Yeah, so I'm so glad that you all are here. I know it's the summertime, so I appreciate you kind of taking time out of a beautiful Friday, at least here in northern Utah. Not the hottest day in the world. My name's Maureen. My pronouns are she, her. I'm an assistant professor of social work at Utah State University. I wear a couple of different hats, and I'll talk about a couple of those today. One of those is as a faculty fellow at the Transforming Communities Institute. So a lot of my research is community engaged research that I do together with the Institute. And I also wear another hat as a co-chair of a community coalition here in northern Utah in the three counties in our health district, if you're familiar with this area in Box Elder County, Cache County, and Rich County. So I'm going to talk a little bit about that coalition building work. Yeah, so I'm going to just, hopefully this will work okay. Start with a land acknowledgement. I think that land acknowledgements are incredibly powerful statements. They definitely speak to a lot of the things that we'll be talking about today in terms of collaboration and engaging with communities, thinking about power, thinking about history. So I'm going to go ahead and read this land acknowledgement, which came out of a collaborative working group here at USU. So as a land-grant institution, Utah State University campuses and centers reside and operate on the territories of the 8 tribes of Utah who have been living, working, and residing on this land from time immemorial. These tribes are the Confederated Tribes of the Goshute Indians, Navajo Nation, Ute Indian Tribe, Northwestern Band of Shoshone, Paiute Indian Tribe of Utah, San Juan Southern Paiute, Skull Valley Band of Goshute, and White Mesa Band of the Ute Mountain Ute. We acknowledge these lands carry the stories of these nations and their struggles for survival and identity. We recognize elders past and present as peoples who have cared for and continue to care for the land. In offering this land acknowledgement, we affirm Indigenous self-governance, history, experiences, and resiliency of the Native people who are still here today. So I wanted to go over kind of an agenda for the day for a time together. And this is kind of a very broad look at what we'll be talking about. Today we're going to organize a little bit as a workshop. So we'll have 4 different discussion points. The first 2 of those we'll have as kind of like whole group discussions. We can use the chat. Please feel free to, speak and answer questions along the way when they come up. You can always pop those into the chat, as Erin was saying, and she'll kind of help organize that as well, which I greatly appreciate. So we're going to kind of divide our time out today in thinking about why coalition building, kind of like what are coalitions, and specifically community coalitions. We'll talk about some frameworks for how coalitions develop and function. I'm hoping that'll be really useful information to just like kind of anchor us, have a lens to look through when we're thinking about the work that coalitions do, which is probably why we're all here, because we care about issues in our communities and thinking about ways to solve them. And then third, we'll look at coalition building to advance social justice and think about those kinds of core issues, because a lot of the literature on coalition building kind of really focuses on what organizations can do, how we can better understand coalition effectiveness. And there's really exciting new emerging research about just thinking from a kind of, shifting that lens a little bit and thinking about not just how coalitions can be effective at some of their outcomes that they're hoping for, but also like within this larger social justice framework, which I think is really promising and cool. And lastly, we'll walk through an example from the field. So I'll talk a little bit about the Bear River Region LGBTQ plus Community Coalition that I have had the privilege to be a part of, and that I'm on the steering committee for. So we'll just kind of talk about what that coalition does, kind of how it formed, and some of the processes that relate to what we're talking about today. Does anyone have any questions before I move on? Okay. Well, that went the opposite way. Okay, so this is a snapshot of the workshop portion that we'll be doing today. So today you'll be identifying an issue that impacts your clients and community. I know we have a ton of expertise in this room, and I'm so grateful to have you all. And I'm sure you have many issues that impact clients in your practice, the community where you live, where your practice might be located, the broader community in which we all practice. So choosing one might be a little hard, but we'll try to choose one and focus on one a little bit today in our discussions. We're going to explore some of your goals for building collaborative partnerships on the issue. At the very heart of coalitions is just collaboration, right? Not just. There are lots of little details there, but so we'll think about how can we kind of start brainstorming what some of those goals might be, and then really this drafting a plan makes it sound a little bit more grandiose than it may be, but we'll talk about some ideas for next steps. So what will your coalition building efforts look like? What do you want them to look like? Where might you be headed in the future? And then we'll share some ideas and resources along the way. Okay, so let's start with a discussion just to kind of like anchor us before we start talking about very exciting coalition building things, of course. So what is one thing that you're hoping to leave this workshop with? You can put that in the chat. Please feel free to just speak together and we'll have a moment to think about that. Oh, Susan said hope. I love that one. I feel like that's why we do coalition work. I think working together with communities and partners and getting that forward momentum to create change is so important and can be a part of creating more hope. Thanks, Susan. Yes. Yes. So I think that unifying for me like goes with hope, right? Like how can we find a way to come together to work on the issues that we care about? And that need is out there right now, right? Like there are a lot of issues to attend to, advocacy issues. Um, Erin said, understanding how to make coalitions sustainable. We'll definitely be talking. I love that word because I feel like it has like kind of multiple meanings, and we can connect that with coalitions that deal with environmental issues and climate change, and then also thinking in a less direct way, maybe about how we actually make those partnerships sustainable for the future. how to be engaged without being overtaxed. There are so many areas that need advocacy right now. Yes, I think choosing the work we go into is a huge part of it. And I think coalitions, like when we have some tools for how to build them, we can kind of build that in and try to work with people's capacity. In the coalition that I'm a part of right now, that's something that comes up, and we've kind of developed this structure that's kind of fluid. Like people come in and work on a project and they may not have capacity for a while. So we'll talk a little bit about that. How to help community residents to have acceptance for people reintegrating back into society from Julia. Yeah, overwhelming. I hear that too, for certain. Yeah, coming out of crisis mode, I think some of that can be just like having those tools, right? Talking through some of the things that are complex issues, but like bringing them down to earth and thinking about like how can we use a tool out of our toolkit to address that. How to share the word in our community better about our coalition. For sure. Yeah, that's like, I feel like that's the always question, right? Like, are the flyers working? Is the social media working? Like, how can we kind of get the word out? And I think part of that is like the organic flow of coalition membership sometimes, depending on capacity. Awesome. Well, thank you all so much. Okay, so let's talk a little bit about why coalition building. So, just to start with a really broad definition, a coalition is a group of individuals and organizations working together toward a shared goal. I think sometimes, like, I'm in social work. I love community social work and community engaged research. And I think we tend to kind of think of coalitions as something that like organizations do. And that's not always true, right? So there are so many different types of coalitions, including grassroots coalitions that may be individuals in a community who come together kind of regardless of what they do for their for their profession, but they share this common concern in their community. Um, Coalitions build capacity for meaningful, sustainable change on community issues. And they do this in a number of ways. So they create diverse partnerships. That's really important. So they may create partnerships that didn't exist before, or they kind of expand the diversity of partnerships across different sectors in the community who are working on different pieces of an issue. And that's really powerful. They use inclusive and collaborative processes. So that's a part of that meaningful engagement for folks who are involved, and a part of that sustainability piece as well. And we'll talk about a lot of specifics of what that means for those processes today. They share resources. This one is like very pragmatic and super important, right? So this is a way that resources can get pooled together, that groups and organizations can come together and seek new resources they may not have, like writing a grant, skill sharing to accomplish that. And then understanding needs and planning for solutions. So we'll talk quite a bit today about planning and how the cool thing about coalitions is that they can follow a process, right? It's not set in stone. It has a lot of like it, like organic nature to it, but there are processes that we can kind of follow to make that a robust planning process to create that change that we're interested in working on. And taking collective action. This is the thing, it's last here, but it's the thing I think of first, right? Coalitions are about that collective action. So folks coming together to do things in the community, create change at an organization, create change across a community system. That may be the education system, could be the healthcare system in a community, but coming together to do that. So, one of the reasons why there's a garden backdrop here is that I am gardening a lot in my garden. I don't know if any of you all are doing that right now. And so in thinking about this talk today, I was thinking a lot about my garden. And I think this is a metaphor that I like return to in coalition work and think about quite a bit because a garden, the the plants within the garden themselves have a mutuality, right? They're interdependent on one another for health, for the health of the soil, to kind of do preventative things. Garden, if you interplant all of these diverse plants together, that can be really powerful for building a healthy garden. There's a lot of like material there, I feel, for thinking about coalition building process. And the act of gardening, especially in a community garden, is really collaborative, right? So it's not kind of like a solo act. It's something that we can come together to do. And it produces food, those ideas that coalitions can go out there into the world to create change that is both meaningful and does like really critical things in the community that are needed. I think another piece of this gardening metaphor for me as well is like root causes. Um, so in social work, we talk about that like, okay, so we have these complex issues that are impacting our community. And we may see them if we're working in the mental health field, for example, kind of downstream at the individual level. Well, how do we travel back up that stream and like look at the ecosystem as a whole and think about what those root causes are for some of those issues? And how do we create change kind of further upstream? And that can prevent a lot of issues downstream. So I feel like that's another piece of that metaphor that I like is it reminds me that, you know, we're going for those root causes. Coalitions have that power to go upstream, to bring people together, to think about kind of like a wider lens on issues. And another layer of that metaphor, and I swear I'll stop talking about gardening, is roots themselves, right? So like we're rooted in our communities, and I think that's a really important part of coalition building. So this is a lot of me talking. If you all want to pop in at any time or put anything into the chat, please do. Okay. So we're going to focus today on community coalitions, and these are special because they bring folks together, individuals, professional organizations, agencies, to advocate for change in a local community system. So they're very community rooted. We know that the challenges facing our communities can be really complex, right? This is just like a short list, right? So that may be housing insecurity and homelessness, food insecurity, suicide prevention, domestic violence, substance abuse. We can think also about the physical environment, issues related to climate change, systemic issues like racism and discrimination, and barriers to accessing healthcare. And that can cross-cut a lot of the kind of earlier things on that list as well. And we could continue like brainstorming these things. So I don't know how many folks in the room have worked on a coalition. And if you have, I would love to just hear about like what it was focusing on. If you want to pop that into the chat or just reach out and say something. Economic development, post-adoption services. Great. I'd love to hear more about that sometime, Sue. Cool. All right. One of these core things that coalitions do. Ooh, there's another. Okay. MCOT, suicide prevention, reentry after incarceration. So those are some really diverse like with coalitions with different like focuses, right, on different issues. But we can follow a similar process, right? So in thinking about what that planning process looks like, this is a quote that I think kind of really encapsulates. I'm not the most like quote person in the world, but I love it when there's a quote that speaks with some depth and context to kind of like what you're talking about in a pithy way, right? So in this one, thinking about how we create a comprehensive plan for action through what we do in coalitions, right? And so that kind of planning process is a way to engage folks. It engages people, it engages ideas, resources across different sectors who are interested and invested in an issue to create a synergy of health and prevention efforts that will have a lasting effect on community health. So this, I like that word synergy, right? So these partnerships are about not just, okay, we did it, like we came together, we care about this issue. How do you create synergy, right? How do you kind of create this environment where people can share these things, where you can collaborate together, where you can build a plan, you engage with your community. There's a lot of components going into that. With this like kind of long view of we want our communities to be healthy places where people can live their lives. They can have safety and security, and they can achieve well-being. So if any of you have worked with TCI before, the Transforming Communities Institute, or come to some of these CEUs, you may have seen this framework before. So this is a framework that we use. We borrow it from public health and adapt it to some of the community engaged research that we do at the Institute. And this is the framework for collaborative community action on health. And we're gonna return to this green part, which is the first step in this wheel, and break that apart a bit. But overall, this provides some steps and an approach that we can take to improve community health and well-being through these collaborative partnerships that we build. It's not specific to coalition building, but it's really applicable to it. So in that first step there, we're assessing, prioritizing, and planning solutions. Assessing is all about we need information to understand what the community needs are and how do we kind of go about that. And there are lots of different methods that we can use. They're not all, you know, like a brand new research project. Some of them are using data on community health indicators that already exist, gathering it, making sense of it. Some of them are a little more community-based, listening to community members, those sorts of key things. And then we'll talk a little bit about what prioritizing means. So once we have that information about the need, where do we go from there, right? So we know there are all these issues. How do we kind of reach an agreement about what's the most urgent or pressing issue to work on? And then planning for solutions. And that's why this green area, we're gonna like build it out a little bit because there's a lot contained here. So we want to plan for solutions that are both driven by evidence and also meet those community priorities that we've identified. Solutions, and that targeted piece is about that, thinking about what will actually work in our communities for solution building. So some of it is going to the literature, gathering the evidence, gathering the assessment evidence that's specific to our community, and then also reaching out and trying to understand what might actually be effective within the unique context of our own communities. And then we move into this orange step, changing community conditions and systems. So if what we're going for at the end here is achieving widespread change, so we want to reduce risk factors that contribute to the issue. We want to increase protective factors that support well-being. And overall, we want to get to that stage of improving community health and well-being. But that really starts in this orange part, right? So that long-term community systems. And I don't know if anyone's heard of those 3 Ps, right? So programs, policies, and practices. That's kind of our target for change. Does anyone have any questions? I feel like I'm going to be talking quite a bit until we get to these discussion points. So you feel free to hop in at any time and stop me. So building out this green first step a little bit more in this framework, assessment can mean a lot of different things. So asset mapping is one of the things that we can do with community partners. This can be a collaborative process. I did a workshop it was actually in an art class here at USU that was super cool. And we did this in a really visual way. So we like had a big piece of paper and we created this map of important resources that support well-being here in Cache Valley. And it was a really cool thing to kind of watch evolve together with students and some of the professors who were there at this workshop. So asset mapping can be a cool art project. It can be something you do once you've assembled some community partners who care about an issue. And an asset is just any resource in your community that contributes to health and well-being. And that can be a lot of different things. You're going to want to, in this assessment phase, think about what data is already out there, right? For those of us who work in professional practice fields, we probably look at this data a lot, right? Like community health indicator data, that could be from the county level up to the state level. I think someone put in the chat something about the SHARP survey. That's something I look at often in my work. It is an assessment survey, prevention health and needs assessment survey that has it's cool because it's longitudinal and it creates this data set that you can look over time and understand what's going on with K through 12 youth. Yes, and then you can conduct your own needs assessment research. This is something that we do at the Transforming Communities Institute as well. So after we've got some more information about what the issue is through assessment, we're going to identify those priorities in our communities. And you might want to start by forming a planning group at your coalition. So maybe you reach out to everyone and you're like, yes, like I know that all these different organizations and individuals and maybe even a community organizer care about this issue and it matters, or a whole set of issues. Well, once we're all together, let's think about forming a group that can look at that research and maybe identify some, priorities within those needs. You can conduct a public forum in kind of a larger setting. You can also do a listening session in kind of a smaller setting with community members to share your assessment research so that they can share with you about the issue. And then you can talk about what are these really urgent community needs. So we know there's a lot of needs out here. And how do we kind of work through a process where we're like, this is the most important one. And sometimes you walk into a coalition and you may know what that is, right? If your coalition is focused on domestic violence, then you have kind of this clear need that you're addressing, but it may intersect with some other needs as well. Okay, and then planning. This is the great part about the sustainable coalition, right? So it's hard when things are on fire to not go and put out the fire any way that you can. And I feel that in my work, even in social work education, like every time I'm in the classroom. But what's good about having a framework is kind of taking a step back, thinking about, okay, yes, we know what's on fire because we've gone through a process to understand that. And then how do we plan for steps that can be meaningful and involve many different partners and community members in that work? So you're going to kind of use those assessment and prioritizing as building blocks here. And then this is also going to be a collaborative process, right? So when you're making a plan, you can plan for all these different feedback loops for community input. So even if you kind of get to a draft of a plan, you could be like, okay, let's put this out. Let's hear from some community members about this idea. Let's make some changes. And at the end of the day, an action plan, you've probably seen like a strategic plan. Coalitions may put that out that are kind of specific to what the plan of action is for the coalition as a group, and what they plan to do. And this is a shared vision, right? For how are we going to create those changes in our community systems? And they do lots of specific things, right? We're going to need to know what are our goals? What are some of the objectives we have that we can measure and keep track of? What are those super concrete steps that we're going to take together? Like spell those out. And how are you going to evaluate the success of what you're doing, that you're reaching those objectives and creating the change that you're hoping to make. Okay. So this brings us to our second kind of discussion point for our workshop. So take a few moments and think about what are some of the key issues that impact your clients or your community. And you can share as many as you would like in the chat. Feel free to also speak. It's completely open discussion. Social isolation, lack of affordable housing, yes. Housing, stigma, child abuse and neglect, intergenerational poverty, political polarization, lack of appropriate financial education, gangs, addiction issues. Yeah, I mean, I think that even within these, access to healthcare, right? That's a good one because access to healthcare intersects with so many other things, right? That can be related to stigma. It can be related to barriers like transportation, lack of housing, poverty, difficulties accessing health insurance, right? That kind of we can unpack that to lots of issues, right? Substance use treatment resources, cyberbullying, family dynamics and how to navigate them. Food, yes. Yeah, so these are a lot of diverse issues that are coming into play in your work and in your community. And I think, you know, any one of them could be addressed through a coalition of folks who deeply care about that issue as well, right? And who may understand different pieces and parts of it from their work in the community or from their lived experience as well. So kind of within those, do you all see any like when you know the key issue that you shared, um, do you see any kind of like sub issues that you can immediately identify that are like, yes, like related to food security, this like the, you know, two or three other things that are critically important? I feel like there's a connection between cyberbullying and stigma that can relate to some other issues as well. As social isolation. So even within that, I think there's connections across your issues. Yes, mental health intersects with all of these, absolutely. With addictions and incarceration, there's an attitude of you did this to yourself versus an innocent victim who's more deserving of support. Yes, deservingness is such a critical issue. Deservingness works into our community systems and can create barriers to accessing services that are really important, can contribute to stigma. Available transportation from less expensive housing. Yes. Yes, we're in a kind of rapidly evolving you know, housing crisis across Utah and really a transportation issue. How do we improve our transportation systems so that we can kind of reduce some of these barriers, financial and otherwise. Awesome. Well, thank you all. I think that food, housing, et cetera, can correlate with lack of resources to better your circumstances, like not receiving education or training. Yes. Yeah. So with that, even with food security, housing security, like maybe there's like education and professional development that are a part of that. So if you had a coalition that was working on food and you had a coalition that's working on housing, maybe they connect about some professional development with an organization that's their skill set, right? Okay, so now we're going to talk about the really exciting kind of theory part. Um, so bear with me. We're going to talk about some things I hope that they'll be useful, and I think that they will. They've been really useful to me in kind of even like reflecting back on some of the coalition work that I've been involved with. So, and having kind of like a place to put it and be like, okay, like it's actually a part of this stage of development. And oh, maybe this is an area where we could really improve something because we haven't talked about this. We haven't thought about it. Maybe we could all read this article together. Um, so coalitions we know they're common. They can be statewide, they can be community-based, they can be advocacy coalitions. And the reason why they're common is that they tend to be a really effective approach to this work of improving community health and well-being. So within that, right, if we want them to be as effective as possible, understanding what makes them effective, those factors involved, can really help us build stronger coalitions for our work. There's a list of references down there that provide some literature looking at the effectiveness of coalitions in public health, particularly, that can be just like useful for going through and, of course, following our trail of references and learning more. Okay, so the first framework I want to talk about is called Community Coalition Action Theory. This is is kind of walking us out of the field of practice and trying to create some guidance around how to theorize that, right? So how do community coalitions develop and function to support this effectuation that we're going for? And this is coming out of the work of Butterfoss and Kegler, started a little bit earlier with Butterfoss's like proposal of this idea, and it's developed out a little further in the second publication there. So how do community coalitions work in the real world? This is what we really want to know, right? And theory can actually help us bridge that, right? So this is a really useful, I think, because it breaks down how coalitions form into 3 different stages of development. So the first stage is formation. There's a lead organization, sometimes called the convener, that's going to bring community partners together to focus on that issue that everyone cares about working on, right? That's a priority in the community. Um, so the lead organization, that sounds easy to say, but that's not always easy to determine, right? The lead organization need to have some resources to do that convening, like even really practical resources, like do you have a place to meet? Do you have a little bit of funding do people need help with transportation to get there? Do you need to pay for a Zoom account or a Google Meet account? So those sorts of things. And then the lead organization too, there are some kind of like different reasons why lead organization might be the most appropriate. They may be the folks who've like led out that initiative in the past, so there might be some history there. They may be a new group that's formed that has a lot of momentum, some resources. So there can be kind of different ways to look at it. There's no like one way to determine who the convener of a coalition should be. Another way to think about that too is thinking about organizations that have representation in the organization of folks who are directly affected by the issue. I think that's another important thing to consider. So particularly in social work, we ask this question a lot of like, who is at the table? When we're making decisions, when we're bringing partners together, when we're working on community issues, who's at the table, right? Who's representing the issue in what we're doing together? And this question is something we should be returning to often in our work, right? The table is not set for perpetuity, right? So there are always folks who can join the table. Your work may shift into a new area, and you need to revisit that question of who's at the table, and together with that, who might be missing from the table. And this early formation part is about like, what's our structure going to be? How are we going to do this together? Organizations all have their own structures for how they're organized. So what's the coalition going to look like? What do you need for leadership? What do you need to communicate? And what processes are you going to follow to get your work? And there's kind of no time limit on this, right? So even though these are 3 stages, you may return to some of these formation things when a new thing comes up. You might be like, oh, we don't have a process for that. Let's develop one. We need a more robust process for that piece of our work. The second stage is maintenance and implementation. So this goes back to that synergy word that I love, right? So if we bring partners together and we want this work to be really productive and we want people to feel really engaged, right? What are some of the pieces we need to do that? That might be like having regular meetings, changing the way you're conducting meetings. I don't know if anyone's ever done that in your work before, but that can be really powerful. Like, today we're going to do a round robin, right? And we're going to go around, everyone's going to share something. Or you know what? We really need a social. We just need a moment to come together and, just like connect before we kind of go back into the work. So member engagement can look a lot of different ways. Erin and I are both on a steering committee for the Utah Conference on Community Engagement, and we were just talking about that with the steering committee, right? Which is a coalition of sorts because it's folks from all over Utah who do work in community engagement. And so how do we kind of like bring new community partners in? How do we make that a welcoming and engaging environment? And what can that look like? Um, this also goes back to that sharing resources part, right? So sharing resources is really powerful. So let folks and building synergy is about how you do that. So let's say someone's like an organization has really great grant writing resources. They may even have like a grant writing team that's paid to do that. Maybe that's a skill that gets shared out to support the work. And then kind of going back to that framework for collaborative community action on health, this is the stage where you're thinking about doing the assessment, prioritizing those needs, and then planning, right? So before we get to implementation, we need to do all of those steps. So this also isn't like a breeze through it kind of stage. When I talk a little bit more about the coalition that I work with here, we kind of, I think that formation phase lasted about a year, and we may return to pieces of it, certainly. And then we're moving into this second stage of maintenance and implementation. So the third stage is all about sustainability. They call it institutionalization. So that's just like a durable organization, right? And the organization itself may be durable and institutionalized and sustainable, or the process and strategy that they're following may be something that becomes institutionalized. So there's kind of a couple of different ways to look at that. This is when you start seeing outcomes. This is the part where you're like, that's the great part, right? You see some of the change you're creating in the community. You're increasing capacity for getting the work done. You're seeing those changes across the community systems, whether that's a policy that you're trying to advocate for changing, whether it's practices that you're changing in your area of practice, or other sorts of conditions in systems. Creating a new program could be one of those things. And then getting to that part where you're seeing that more like widespread improvement in health and well-being. So again, this may be where your coalition becomes a longer term organization. Coalitions don't have to be nonprofits, but they can be. So that could be a brand new stage of development, or the strategies that you're using are sustainable. So maybe the coalition disbands or kind of goes on hiatus until it needs to address another need. But some of those core strategies you've been using are adopted by other organizations. Okay. So if you look at community coalition action theory, there are a lot of different constructs. I think there's like 17. So we're going to talk about two of them. And these are just ones that speak to me, and there may be something in there that's more to you. But this first one is community context. I think this is probably one of the most important things, right? Um, our communities are unique. And if we're going to build coalitions to get this kind of work done, we need to understand that context. Um, I am a social worker, I'm also an anthropologist. So this community context piece is really important, right? I think we can kind of like take that time to go into some depth. This is where, building relationships with your partners can be really great. Like maybe you want to understand more of the historical context in your community for some of the issues. When did they start? How do people view them? How do people view causes? How does those issues of like stigma and deservingness play into that? And then you could go to that organizational level too and think about what's the history of how all these organizations have collaborated. I'm sure that all of us have worked in contexts where there's some history of conflict, right? And so how do you navigate that? How do you work through it and build for the future? Building trust is a piece of that, right? That's trust between groups, particularly groups who've been historically marginalized and are going through ongoing processes of discrimination and marginalization in communities. And that can be trust between organizations too, who may have a history of, some conflict in the past. Politics, right? That is a world of its own within coalition building. So there's like, we could just kind of go out and out. There's like, politics writ large, and there's the politics between organizations. There's, governance within communities, and how does that work? And then community readiness. And coalitions can be a part of that, right? So the fact that your coalition is forming is a good indicator of community readiness. People care about the issue, they want to organize, they want to address it. And then you can kind of do some work out in the community, some outreach to your assessment process can be a part of building community readiness and buy-in. So the other construct from this theory that I think is super useful is pretty simple, right? Like you do need to develop clear processes for how your coalition will function. And those are really pragmatic things. Like, how are we going to communicate? Is it by email? How often? Are we using a platform to communicate? What does that look like? How are we going to make decisions? Are we using Robert's rules? Do we rules? And so we need to create our own process. Um, Planning, that goes back to what we've been talking about. Evaluation, right? How do we know when we reached our objectives? And then conflict management, having a process for that. And because we're humans, right? Things are going to happen. People are going to disagree. And so how do we create a culture around how we're going to handle that? And then a robust process so people kind of like know the steps. Okay, I'm going to take a pause for a minute and see if there are any questions or anything that you want to talk about before I kind of move on to the next piece. Okay. So this next framework is collective impact. I don't know if any of you have heard of collective impact or read about it. I think it was kind of buzzy for a while, and buzzy isn't bad. But this is a framework that is useful because it thinks about kind of from the organizational level, like what do you need to be successful in your collaborations? And this is specifically looking at those collaborative partnerships that go across different, sectors. You may be, social workers who work with community members who are impacted within their client population. This could be working with policy advocacy groups, working with government officials. So those kinds of diverse partnerships that are really focused on creating social change. So this outlines 5 conditions for how we can be successful at that. The first one is building a common agenda, right? So we need to have that shared vision for change. We need to have that common ground for working together. This second one is also really important, right? We need a shared measurement system. Um, so we need to come to some agreement about that as well, right? So how are we going to measure our outcomes for change? What kind of data are we going to collect for that? What kind of community level indicators are we going to track? If we're interested in food insecurity, are we going to track measures of household food security that are already being collected? Do we need to collect those in a different way? Thinking back to environmental issues, childhood asthma rates may be something, community data that you're following as well. So thinking about how you measure can be really helpful in building that sustainable piece of your work together. Mutually reinforcing activities. Okay, so we have all these diverse partners who are coming together to work on this issue. Um, they don't all have to do the same thing, right? Like they all do amazing work in different ways. You can work together on the same activity, or you can kind of, figure out what works best for a particular group. So the idea here is more about like coordinating and making sure that like those puzzle pieces are coming together, then everyone's doing the same thing like all the time, and that you're following the plan for action that you've built. Continuous communication. I don't know if anyone has worked in an organization where the communication is not good. It's so hard, right? And having a process for it and also having a process to talk about it when it's kind of not going well is really important. So having that good communication is really at the heart of how we create effective partnerships. It helps us develop trust. It creates a process for what we're doing in coalitions. It helps us to make decisions together. It helps us to solve problems together when we're regularly communicating. So, holding meetings is great. We need that. They need to be regular. We need to kind of like know what the schedule is, know what the expectations are. And then in between those meetings, we also need to communicate. So I think, it's hard when you kind of like get out of a meeting, you're like, that was great. And we did so much and we talked about so much. And then everyone kind of falls off the map a little bit, and then they come together at the next meeting and it's kind of a scramble to be like, where were we? And what are we doing next? And so this piece gets past that continuous communication or lack of continuous communication issue. And having a backbone support organization. So this one may be kind of resource dependent. I don't know. There may be organizations that can kind of come together and work on these things, but in an ideal world, which is not always the world that we live in, there would be an organization with staff who are dedicated to doing this work. And they are separate from the partners who've come together. So there are folks who do facilitation. They may be the folks collecting data and summarizing data and making it publicly, disseminating it in a way that folks can access it. They may be doing project management as well. So again, this is kind of an ideal world thing, but I think it's an important one to think about. Like, is there someone who can facilitate meetings, who has experience doing that if your organizations kind of don't, with large collaborative settings like that? Or an organization that does research. Okay. So let's take a moment. We're going to go into breakout groups And let's take some time to share the community issue that is important to your work. And after that, think about who needs to be at the table in that work on that issue. So if you're already in a coalition that's working on an issue, who might join the table? So let's think about the issue and sharing about it and why it matters to your work and your community. And then who needs to be at the table? So who are the partners that might come to your coalition? And then after we go into breakouts for about 5 minutes, maybe 5 to 7 minutes, we'll come back together and share with the whole group. And Erin will lead out the breakouts.
Are you ready for me to open those?
Yes. Thank you, Erin. Welcome back. We'll just wait a moment for folks to come back from their breakout rooms.
Everyone should be back now.
Okay. Welcome back. Does anyone want to share what they talked about in their breakout room?
I can.
Perfect. Thank you.
So we were discussing just one of the coalitions I work with in Weber County. It's the Reentry Coalition for where we have like the Weber County Sheriff's involved, and like Weber Human Services for mental health and other treatment providers, and our housing, Ogden Housing and Weber County housing authorities. But we were kind of talking about what I thought might be missing is the transportation, because that's one of our big barriers that a lot of the people we work with come into, is transportation to employment and appointments and stuff.
Mhm.
And I've been working here for 9 years, and it's been that way the whole time. And
Yeah.
one that is so hard to get other agencies, and I don't know how to explain it, like be able to get the resources and into the community.
Yeah.
That's kind of what we kind of talked about.
Yeah, like there's maybe a missing piece to like, yeah.
Yeah. It's probably under state level is what needs to happen, but
Yeah.
probably won't.
Yeah, but I mean,
definitely needs advocates. So
yeah, advocates and folks who maybe I wonder, how do you think government officials play into that? Is there like policy around transportation that
I know some of the like funding is a big one,
oh
obviously,
yeah.
and then also like looking at policies like safety and stuff like that. Like, but I just recently I saw that the ride program that Weber Human Services had for the like seniors, they have pulled their funding. And so it's decreased, at least. It's not all the way gone, but it's gonna decrease, and I'm a little worried on how that's gonna affect our population up here.
Yeah. Yes. Well, thank you so much for sharing.
No problem.
Does anyone else want to share a little bit about what they talked about in their breakout group?
I'll share.
Wonder.
My Hi, I'm Julia, my breakout partner and we had a very lovely discussion, and we talked about some of the housing problems that the population that she works with and the population that I work with, we're up against it. And of course, it comes back down to funding. When you were talking about, folks newly getting sober, folks coming out of prison, a lot of landlords are really reluctant to rent because as soon as I rent, you go back to using, you trash my apartment, and now I'm on the hook to clean it up and fix it and repair it, and make it right. And the people that I work with acknowledge that. And they're like, yeah, that happens, but it'll be different this time, right? Of course it will be. And I think if there was some kind of a safety net for landlords to know that if this happened, there would be an organization that would help defray some of that cost, plus an organization or some training or some teachable moments to help, folks who have maybe never gotten an apartment on their own. They've just been living in trap houses or with friends to, this is how you treat a place. This is, these are the steps to secure a place. And so we talked about housing and how the populations that we work with can secure it in a safe environment.
Yeah.
Isn't
Yeah.
Julia awesome?
No.
You are.
That sounds like a wonderful conversation,
That's
and
good.
that there's like definitely some diverse partners who'd need to be involved.
Right. And we need money, but
Yeah. Yes.
but you also need, you need, like social workers or case managers to help teach this is how we do it. And then also working with landlords to help encourage a willingness to give folks coming back into society from incarceration, help give them a chance. Right.
Like that just has me thinking as someone who does not work in this area at all. But how cool it would be if those like educational opportunities had a moment to intersect. So like landlords and folks seeking housing and who are trying to get out of like housing insecurity could kind of have like a moment to talk and be like, oh, we learned this thing today and it was really cool. And like I think sometimes there's just this like you're kind of in your own tunnel of like what your needs are and what some opportunity to connect.
Right. And it's the same for Nora and I discussed. It's the same for folks who are in treatment, who transition to sober living, and then they want to move into independent living as well. There's just a lot of steps involved in that. Anyway, it was a good discussion. Thanks, Nora.
I would like to say something if that's okay. It's kind of related to what y'all have been talking about. There is a group called Landlord Tenant Mediation at the state level, and they actually hold classes weekly that anybody can attend, landlords and tenants. And they talk about things like how to be a good tenant and what to do and those kinds of things. So just so you know, that resource does exist. Not necessarily a coalition, but it is out there.
Well, the crazy thing is, this is the first time I've ever heard about it, and I've been working in this field for 10 years in Utah, right? So that's nuts.
Yeah, someone had put in the chat about getting the word out. I think getting the word out, it works so many different ways because there are great resources out there, and then like having that information, having access to it, having a hub, that can be a really powerful thing to find those sorts of things in your community so folks know where to go. Yeah. Well, thank you all so much.
Can I just share one quick thing
Yes,
related to
please
that?
do.
One thing that came up in our group is that sometimes when you bring a coalition together, people will have answers to each other's problems and not realize, and that kind of previous comment made me think of it. And I've been in that setting where, wait, you have housing vouchers for kids transitioning to adult living. Well, how do I get that? And we sit here in our kind of bubbles, understanding our own services and waiting for people to come and get them. And that coalition just has the power to provide that information and serve people on such a higher level.
Yeah, I love that idea of breaking out of our bubble or out of our kind of like our silo network and kind of expanding out from that. And that might be one of the superpowers of coalitions. Well, thank you all so much. Okay, we're gonna take a different branch here and think about one more framework for coalition building to advance social justice. So I just this is a quote from Martin Luther King that I can't tell you how many times I've returned to in my work. I need it somewhere. It needs to like live somewhere here in my office. But we're caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. Um, this is a powerful one. I think that goes back to that heart of coalition building and thinking about collaboration, mutuality, and those root causes and the roots that we have in our communities. And remembering that when we're working on social justice issues in our communities, that we're walking in really good company with a lot of folks who've come before us doing this work and who are continuing to do it. And I find that in thinking about Susan's comment earlier about hope, I find that to be really hopeful. And also really helpful to go back and look at examples of community organizing and coalition building in history, and have some historical context for that and like what worked and what didn't and what applies to our time now and what doesn't. So I love kind of returning to some historical context. So we know that issues that communities face are complex, they're intersecting, and our effective solutions need to be really rooted in mutuality. So I think this is where advancing social justice can use some of those tools, be it from the civil rights movement or other examples of grassroots organizing, and how also how professions have approached social justice as well. So this Collaborating for Equity and Social Justice framework defines principles for advancing equity and social justice through coalitions. And one of the things that they're trying to address is that there are some limitations in like the collective impact model and other models for thinking about coalition effectiveness, in part because they do focus more on that organizational setting and what can we do in our partnerships from the organizational level. And we need to kind of, broaden our scope and think about rights holders and stakeholders, folks who are directly affected by the issue. And are we really, looking at those power dynamics and relations in how we're working together. And then also when we go back upstream to those root causes of these community issues that we all are coming together to work on, remembering that there are structural inequities within that, like racism and discrimination, and how do we address that in our coalition building work as well. So I'm not going to walk through all of the principles in this model, but I am going to talk about the first three. So I think the principle one is pretty powerful because it's telling you like, yes, like we do think about these issues, but are we explicitly talking about them in our coalition? Are we explicitly addressing them in our plan, in our work, in our assessments? So really explicitly addressing issues of social and economic justice and structural racism. So going back to those root causes and thinking about the contexts within which they occur and how those contexts can perpetuate injustices within the systems that we're trying to create change in. The second principle is employing a community development approach where we're thinking about power dynamics, we're thinking about ensuring that residents have equal power in the work that we do, whether that's determining the agenda, those kind of action steps we're taking, how resources are shared. So a part of that, and for those of you who are social workers, like we talk about this in our code of ethics, right? So like creating those meaningful and broaden opportunities for participation in decision making. And again, keeping in mind those sorts of power relations when we do these things. Principle number three, and the last one that we'll talk about from this framework is kind of going back to this grassroots approach, thinking about community organizing as an intentional strategy in our coalition building work and a part of the process that we're developing, and building resilient leadership and power. So this all comes out of Wolf et al.'s piece in Nonprofit Quarterly. And when you all get a copy of this, there'll be a resources at the end that'll send you a link to that. It's a short piece and it's really cool and powerful. So this is really thinking about like, how do we get back to that kind of like grassroots approach? And that may be as simple as like, are you working with a local community organizer in your coalition? Like someone who knows all the organizations, who may also work with individuals, could be a mutual aid network, could be a collaborative, a collective, or other organizations as well, professional organizations. And then also focusing on community voices and inclusive decision making within that. So I just thought that these were like important for kind of like zooming back out and really thinking about the lens that we apply in our coalition building work. So lastly, I want to talk about, and we're going to talk pretty briefly so we have a moment to, I think we'll just have to switch the last breakout into kind of a whole group discussion, but what does coalition building look like? And an example from the work that I'm a part of. So the community coalition that I am on the steering committee of is the Bear River Region LGBTQ+ Community Coalition. We're a year old. We had a birthday party in May. This coalition formed as part of a community engaged research project that was facilitated at the Transforming Communities Institute. And our mission at the coalition is to improve health equity and holistic well-being for all members of the LGBTQ+ community in Northern Utah. So I'll talk a little bit about some of the process of how the coalition has formed within that community action theory, thinking about the stages of development. Our members are LGBTQ+ folks, allies in the community and community organizations. And we do take a regional focus of those 3 counties across Northern Utah and thinking about those connections. Because I think sometimes, like it's interesting because Cache County is classified as metro. I am not from here. I'm not from Utah. I'm from, I grew up outside of Indianapolis in Indiana. And so metro is a little stretch for me, but I believe the state when they say that that is true. And then our neighbors are classified as rural, and Box Elder is a rural county and Rich is a frontier county. So they're quite rural. So thinking about kind of like widening our scope to think about what we can do to improve community level protective factors for LGBTQ+ folks who are living in rural communities and metro areas who may have access to more services. So some of the structure, so during that first year of our development, we're really in that formation stage. Our meetings were facilitated by TCI, so they were the convener and also a local pride center in a partnership. We worked on some, this is like collapsing a ton of work, which is good to talk about, but I'm like, wow, that was like a lot of things that happened. Defining a mission together, developing a structure and processes for the coalition that we're going to follow. And then doing this planning part, right? So that included some we started the project with some assessment research in Box Elder County that was facilitated by TCI. And it was a part of like the initial project. And I think we have someone here, Emily, who has worked on this work as well as a community partner and a member of the research team, which has been really wonderful. And so then we kind of moved into this new phase after this initial assessment about the community needs for services for LGBTQ+ youth and families in Box Elder, to thinking about some solution-focused assessment research to feed a community planning workshop that we put on in March. So I kind of feel like we're moving out of the formation stage and into this maintenance and implementation stage, the second stage. So our partnerships are changing a little bit. We have a sustainable structure. So we have a steering committee, and then we create working groups when we have a project. We're developing a community action plan, and we're still partnering with the local Pride Center to coordinate some of our efforts, including working together on grant writing, and then also still partnering with TCI, but really kind of shifting into the, community engaged research and shifting kind of out of the facilitation. So we do hold hybrid meetings that are regular twice a month. This is an intentional process so that folks can join who may have transportation issues, so that the hub isn't always Logan. We do meet in Logan because most of our coalition members are there, but we all bring our laptops to the meeting, or iPads, and so we're all on the Zoom, and we have a camera in the room. So we try to make it as like hybrid inclusive as possible. So it's not just like, someone on the Zoom and then everyone's in the room and there's this disjointed feeling. And this again, helps address some of those barriers, accessibility, transportation, and also concerns about safety. This is a roadmap for our community action planning process over the past year. So I'm just going to walk through this pretty quickly. So after this initial assessment research that we did in rural Box Elder County about services, we did some assessment research about solutions, and this is that priority piece. So, we know we have some information about what the needs and service needs are. And so, what are the priorities that we need to work on moving forward to improve health and well-being for LGBTQ plus folks as a population that is a health disparity population, a social determinants of health, and experiences historical and ongoing marginalization and discrimination. So we did a co-design of a new survey research with TCI and the coalition and Logan Pride. And so that process took place January through March. And then we co-designed the workshop together using the data from the survey research and put on a public workshop in March. And the purpose of that was to develop solutions with the community. So this is kind of one of those where, folks have different capacity, and sometimes that capacity is like, I can totally come to a 2-3 hour event on a Saturday that I'm excited about, but I may not be able to do like coalition work twice a month, every month. So we built some collaboration, got a lot of community voices involved, explored some new partnerships, and then also are working kind of taking the workshop findings and working on developing a plan for action. That'll be like a 3-year plan. We probably don't have all the time to go over this large table, which is from a poster that we gave at the Utah Conference on Community Engagement this summer, earlier in May, but it kind of outlines this process for engaging and assessing, prioritizing and planning, and then moving on to implementation, which will really start happening in the fall once our community action plan is together. And this is an example from the workshop findings that just came out. And this QR code will take you to learn a little bit more about the coalition if you're interested. Okay, so we have a few minutes left, about 5 minutes. And so I thought maybe just as a whole group, instead of a breakout, we could think about some goals for those partnerships that you talked about before, for working on the issue of concern. Like, I think probably some of you may have already gotten to this in your discussions. And then what are some next steps that you might take to build a strong coalition on this issue? What do you think coalition building might look like for you? So if you all want to talk, you are more than welcome. This is an open discussion, and also the chat is a great resource too. Can put the QR code back up. Oop. Okay, there's the QR code. Sorry about that. Flashing through. Okay, let's return to our discussion. So, yeah, so what are some goals you might have for your partnerships on the issue that you're hoping to work on or are currently working on? And what might some next steps look like? So Susan said returning to a needs assessment mindset. Yeah. Definitely. I think assessment can be iterative too. Like we can return to it, right? Like and do it in different ways. Like with the coalition that I'm a part of, we started with this initial services assessment in Box Elder County, and then we kind of went back for more assessment that was solution focused. Like we know about some of the needs, but what are the solutions that are going to work in our community? What are the priorities for addressing those things? And so I think returning to assessment is great. And it doesn't have to be research, right? Like it can be other methods for doing assessment. We just have about a minute. So if anyone wants to share anything, that's totally awesome. Any thoughts are welcome. And I just want to thank you all for coming um, and spending some time today out of your lovely Friday. And I hope you have a great weekend.
Thank you. Thanks, Maureen. This has been really wonderful, very informative, very inspiring. I did just put the evaluation link in the chat. I will also send that via email immediately after this session. I believe Maureen also offered to share her slides with everyone, so I'll be sure to include those. There's a lot of great nuggets in those slides, Maureen. Thank you. Again, if you have any questions about continuing education, you can direct those towards me. And then we hope to see you in a month for our next session, which will be the facts, limits, and frameworks presentation that was scheduled for May. That was canceled. We've rescheduled it for July with Chris Meyer and Kara Murray. So I hope you can all join us then. Thanks, everyone. Have a good Friday.
Thank you all.